This is Dr. Michael Weber from the European Laser Academy and European Laser Clinics. Welcome to another webinar on photomedicine. The topic for today is regenerative medicine, the combination of low-level laser therapy and photomedicine with stem cells and exosomes and functional medicine. The basic information about how photomedicine works you can find on the free webinar on the link of our Photon Care channel on YouTube. Well, topic for today is basic information about photomedicine. Where are the main antenna pigments, mitochondrial medicine, the combination of stem cells and exosomes together with photomedicine. And on this opening slide, you see the different devices that can be used in photomedicine. We can work transdermally, and we can work interstitially, intravenously, as you see in the colored picture on the side of the cartoon. Well, all of you who attended prior seminars know only few colors can penetrate down into the tissue. Basically, it's the visible red and the non-visual near-infrared light that gives deep penetration down into the tissue. Of course, for photomedicine, we need the other wavelengths, the other colors as well, but they are of no use for transdermal irradiation or, let's say, limited use. Blue light, for example, highly effective in infected wounds and other infectious skin diseases. Well, we have this optical window for penetration of photons down into the tissue. And it's from the visible red light, something around 650, 670 nanometers, 808, a typical wavelengths of near-infrared, and 950, 910. All these colors give good penetration down into the tissue. Why do the other colors do not penetrate? Because we have different pigments and different structures that absorb the photons. So the green light irradiation will be absorbed, especially by the hemoglobin. Other wavelengths will be absorbed by water, especially in the far infrared area. So we have this optical window by which we can get best penetration of photons down into the tissue. So the laser beam that hits the skin will be partially reflected, partially absorbed, spread, scattered, and transmitted. And one of the most important informations you may already know, but from the whole webinar is how can we get best transmission? And this is the fact that we need good coupling to the tissue. So if we work with a laser scanner, it's very nice to irradiate a huge area. But in these cases, we have lots of reflections of the photons, so we lose much of our effectiveness. If we work with contact, we get good flow of photons down into the tissue. And if we have a pressure effect on the tissue, we even can enhance the penetration of the photons. Another information from this cartoon is visible red light doesn't penetrate as deep as non-visible near-infrared light. The penetration of the near-infrared light, non-visible, is egg-shaped, whereas the red light is somehow bell-shaped. What are the main targets for photomedicine? And when we talk about stem cells and exosomes, we have to recall this basic information because this explains why the combination of stem cells, exosomes, and laser is so powerful. So one of the main targets for photomedicine are the powerhouses of our cells, are the mitochondria. On the inner mitochondrial membrane, almost all our energy is produced. The production of ATP, adenosine triphosphate, takes place in this area. And we have these 5 complexes of the respiratory chain. This is complex 1, vitamin B3, complex 2, riboflavin, vitamin B2. Then we have the coupling, connecting coenzyme Q10, ubiquinol. And then we have the main target for red and infrared, the copper-dependent cytochrome C oxidase. We see we have a flow of electrons on the membrane space, and in the end, we have the production of ATP. So what happens if we irradiate the tissue? And here I picked up a publication from 2015 where they measured not only the ATP production, but at the same time they measured the membrane potential. So it's not only as simple as we usually summarize: laser irradiation enhances the metabolism, enhances the production of ATP. There's much more to it: the membrane potential, the pumps, the proton pumps are affected. So we irradiate with the laser. And here in this study, they checked after 3 to 6 hours. They used either classical laser, low-level laser, or they used light-emitting diets, special diet, high-quality diets with a rather narrow spectrum as well. Well, they don't coherent, but they had clinically the same effect. And as you see, on the one hand, we have a huge higher amount of electrons that flows through the intermembrane space. And in the end, we have a booster for ATP production. The more mitochondria are in a culture that I irradiate, the more mitochondria that are in organ that I irradiate, the higher is the effectiveness of the photomedicine. So when I irradiate muscular cells or hard muscular cells, myocytes, I have an outburn of ATP production as shown in this cartoon. We see the membrane potential is enhanced as well. So the in-pump of electrons and out-pump of H+ is much faster than in the resting state. And at the same time, you see in differentiation to the control group, the booster of the ATP production. So they described a well-defined time response for increase of ATP synthesis mediated by the membrane potential. And they focused in this study on the myotubes, where they could demonstrate all these results. Well, photomedicine has huge impact on every organ that gets irradiated. On the one hand, we have the mitochondrial effect, but at the same time with photomedicine, only use of photomedicine, we can booster stem cells. There is this famous study from my dear friend, Professor Yuri Uron from Tel Aviv, who demonstrated many years ago in the small animal model and in the dog model by irradiating the tibia bone, that he could increase the number of circulating stem cells by up to 700%. Later on, he repeated the results in the human, and he found out that it's not only a temporary effect, but after 2 hours, you could measure a significant increase, but one day in 4 days, it was a constant increase of circulating stem cells. So it's not only a short-term effect, but it's a lasting effect. We did perform similar studies, and here's one of my publications on photobiomodulation to activate stem cells. In some of the patients where we irradiated with contact to the tissue at the best, and achieved an increase of circulating stem cells by up to 2000%, irradiating all along the tibia bone, not only the tuberositas. So first information, laser is very powerful to activate the stem cells, and the stem cells are the source of regeneration. So we know about the stem cells, but what is with the exosomes? And I'd like to say the bigger exosomes, the so-called microvesicles. The exosomes are the result of the microvesicles. Microvesicles are bigger than the exosomes, but the microvesicles release the exosomes. And here is a study where they investigated on photobiomodulation induction microvesicle release in a specific group of human keratinocytes. And they described that is a phosphosilin 3 kinase dependent effect, but not only, even when they locked down the PI3 key, they still could see the increase of release of microvesicles and release of exosomes. So another information, we not only booster self-healing capacities by activating the stem cells, but we activate the microvesicles and the exosomes as well. Here are some examples from tools for photobiomodulation by which we can activate the microvesicles. The summary of this study I just presented is photobiomodulation was able to increase microvesicle release from human keratinocytes. So we are talking of human tissues, not animal model. And they used a high amount of energy. I'm surprised. Usually we work at the best with about 4 joule per square centimeter. They used 32.5 joule and could stimulate the release of microvesicles by 150%. Plus minus 15.1%. So another mind-blowing study in my eyes. Well, the stem cells we release, for example, from the bone marrow or from other organs like adipose tissue or other structures can develop into anything. These mesenchymal stem cells are pluripotent. They can develop in almost all tissues. They are derived from adult tissue. And we know from stem cells that they are anti-inflammatory and argue the repair of injuries, not only in the animal models, in the human as well. And when we use the patient's own stem cells, autologous stem cells, we don't have the issue of rejection or ethical controversy. So stimulation of stem cells by photobiomodulation over bone marrow to release into the bloodstream, or just irradiate over the liver with good coupling to the tissue. I have many patients with terrific results in fatty liver, non-alcoholic fatty liver disease, in unexplained elevation of transaminase and in unexplained hepatitis situations. So exosomes, the smaller microvesicles. The microvesicles are 10 up to 100 times bigger than the exosomes. So this old man, like I am, learned in medical school, exosomes are for the rubbish. The cells secrete to renew themselves, but now we know the exosomes are full of cytokines, are full of regeneration capacity. Cells communicate from head to bottom by a release of cytokines. So in 1963, there was the first description about the exosomes. We didn't know what's behind it. In 2006, there was a Nobel Prize to explain how exosomes and stem cells do communicate with each other. And now we are at the edge to in many situations, even replace the stem cells by the exosomes. And as I will show in the upcoming slide, the potential of the exosomes is much higher than the potential of the stem cells in many situations. Well, you see here in the upper cartoon, we have this microvesicles, and they release the exosomes. The exosomes have a double membrane and contain a huge number of anti-inflammatory substances and cytokines. They are very important, uttermost important for intracellular communication. They are natural messenger particles. They are unique to the cell of the origin. So the exosomes from the heart cell are different from the exosomes of the liver cell, from the fetal cells or whatsoever. Exosomes have been described highly anti-inflammatory and therefore have been used in clinical situation in chronic inflammation. They produce many anti-inflammatory cytokines, and by this promote healing processes. It may be for anti-aging effects of the skin tissue, it may be for wound healing, it may be for osteoarthritis, and I will give two examples in the end after the summary. How many exosomes treatments are required? Well, it depends very much on the quality of the exosomes. Poor quality exosomes, you have to repeat maybe 6 to 10 times to get a good clinical results. High quality exosomes in combination with photomedicine, you see there the different ways of photomedicine will boost the effectiveness. And in many situations, after days already, I usually calm down the expectation to the patients and will say, after 4 to 6 weeks, you will see the clinical results of the exosome, especially if you combine with photomedicine. Sometimes in deep located tissues, we use interstitial or intra-articular laser. In many other situations, the transdermal irradiation. If you have a good coupling to the tissue, a good contact to the tissue, you'll get terrific results. Well, the exosomes that we suggest, the exosomes, as all the others, but they are much more pure. They have a higher content of exosomes in comparison to almost all competitors. Exosomes in general, as mentioned before, are anti-inflammatory, have an antioxidant capacity, and any chronic inflammation, any chronic disease, I may say, is characterized on a physiological level by an increase of ROS, reactive oxygen species, and quite often with NOS, with nitrosative oxygen species. Exosomes have a huge regenerative capacity, and they even have a whitening effect to the tissue. And last year, I was invited as a keynote lecturer to Targeting Mitochondria in Berlin, a fantastic congress every year. And they discussed that exosomes can be terrific tools for bringing substances down into the cells, down into the tissues. The exosomes are so small, so tiny small, that they can penetrate into the dermis. Maybe 95% of the creams that we put on the tissue are of limited or no value because they do not penetrate. With the exosomes, we can bring other substances down into the tissue. Not topic for today, but nowadays we start to use exosomes for PDT, photodynamic therapy, to bring substances, photosensitizers in specific targeted tissues. So it's an exploding, fantastic field of medicine that is arising. Well, whether I work with stem cells or whether I work with exosomes or whether I work with both, there are certain parameters that influence the final result. Where do I get the exosomes from? Are they from adult tissues? Are they from tissues that multiply a lot? How do I inject? How fast do I inject? Do I use filters that may alter the effectiveness of the exosomes and the stem cells? Of course, the patient's age is important, whether there are scarrings, and most important for my opinion is you always should combine the stem cells and the exosomes with laser irradiation. Here an example with yellow laser irradiation intravenously in a patient suffering from multiple sclerosis and getting great results by this form of regenerative medicine, plus of course looking into the cellular situation, looking into intercellular minerals and vitamins. So it's not that easy, just inject exosomes and stem cells, but you have to have the best possible environment for survival of the exosomes and stem cells. And this means having not an acid situation, acid, low pH level, having the right amount of minerals and trace element, and having the capability of photomedicine. Well, what are the effects on the tissue? As I mentioned before, anti-inflammation, they have bactericidal effects, they have great capacity for reparation, the exosomes lead the stem cells into the inflamed area. We have the capacity of regeneration, so we have growth factors, we can stimulate fibroblasts and many others. We can increase the production of elastin and collagen. We can induce production of hyaluronic acid. So combination, stem cells, exosomes, PRP, and laser gives a huge variety, as I said before, from head to bottom, for medical indications. Why is it so challenging to combine mesenchymal stem cells, in brackets, exosomes, with the effect of photomedicine? Well, it's not only my idea, it's not only the idea of the European Laser Academy. It has been published in many papers how effective this can be. Here, a summary of different publications where they use visible red light 660 nanometers, and non-visible 808 nanometer wavelengths. And in their conclusion, they come to the final result. PBM, together with mesenchymal stem cells, enhance the differentiation of the stem cells, the proliferation, and the migration of the mesenchymal stem cells. What does it mean? If I irradiate a tissue with a laser, I enhance micro and macro circulation. And this means the stem cells and the exosomes can flow much faster into the irradiated area. They have to multiply themselves. They are stem cells. They have to reply themselves multiple times. So this is the proliferation. And this requires what? Requires ATP, adenosine triphosphate. So it's another benefit to combine differentiation, proliferation, migration. Of course, to get the best possible results, I have to be aware about my settings, my laser devices. What is the best energy density? What is the power output of my device? As I mentioned before, very important is contact or even sometimes some pressure effect to the tissue to enhance the transmission of photons down into the tissue. How often do I have to irradiate, and which sort of lights do I use? When I want to booster injected stem cells or exosomes into a knee, and when I irradiate from outside with blue light, has almost no effect. So I have to know about the optic window, for example, to get the great results. This I presented before in other presentations, so I don't want to go into much detail, just to give you the information that we have to have in certain situations, the different colors. So by green light laser, it's not only that I booster ATP production. This is even better with red light. There we can see in many studies an increase 150 up to 400%. Here only an increase by 30%. But green light is very important to enhance the reduced form of coenzyme Q10, the ubiquinol. Green is absorbed by hemoglobin, therefore green light doesn't penetrate deep into the tissue either. On the other hand, green light irradiation intravenously decreases the acidity, decreases lactic acid. It enhances the elasticity of the red blood cells. So it has, let's say, an anti-clotting, anti-thrombotic effect, reduces the blood viscosity and improves the blood flow. It enhances the reactivity of the platelets. So there is, just to give you an example about the different colors. The general effect of photomedicine looking on exosomes and stem cells is the cellular signaling that is achieved by PBM, by biomodulation. So we irradiate a tissue, the photons will penetrate, especially with red and infrared, down into the mitochondria, will be absorbed by the different components. We enhance, on the one hand, again, the ATP production and enhance the membrane potential. This is first. Then we activate certain messenger substances like NF-kappa B. By this, a huge amount of repair mechanisms are induced. DNA and RNA synthesis are induced. More than 100 different repair genes have been described being induced by this. Exosomes contain DNA. Exosomes contain microRNA, contain microRNA and mRNA, messenger RNA, and sometimes even mitochondria. So we have a directly boosting effect on the stem cells and on the exosomes. We know from other studies that IV laser irradiation, so once again, visible red light, 650 here, 632 nanometers, can induce the building of giant mitochondria, powerful mitochondria. So there are many, many effects, even on the structure of the mitochondria by the laser irradiation. And we talk about regenerative medicine today. Fantastic is the effect of the blue light irradiation. Well, blue light has to go IV. It doesn't penetrate if I don't want to use blue light for anti-inflammatory superficial problems. There is more and more papers showing that by an increase of the bioavailability of NO, nitric oxide, especially there are 4 forms of NO, nitric oxide, especially the bioavailability of endothelial NO, increase the activity of the telomerase and delays the endothelial cell senescence. So when we talk about atherosclerosis and rigidity of the vessels, blue light irradiation seems to have an effect, a positive effect, to slow down this progress. For those who know me, my love to coenzyme Q10. From coenzyme Q10, there's a good study by Professor Jörg Bergemann from Sigmaringen University that coenzyme Q10 does similar. It reduces the shutdown of the telomeres. So if we talk about regenerative medicine, we have to think about the whole package. This was lots of theory. In the end, some examples, one examples that all of us see in our clinic every day is an orthopedic problem, the osteoarthritis in the 4 different stages. And according to the stage of the disease, our concept is pick up the patient where he is. So in a grade 1 osteoarthritis, we do not need to inject exosome stem cells, do intra-articular injections. But in the end stage, to prevent a surgical intervention or to reduce at least the pain almost rapidly, we have to do the whole register. So this would be the whole register, PRP plus exosomes plus mesenchymal stem cells plus interstitial laser irradiation. So we can inject. This is what the orthopedic surgeon does since the 70s. So for almost the discovery of the exosomes, they started to inject PRP, platelet-rich plasma, to reduce the pain, to enhance healing processes. We use the same needle to inject the exosomes or the stem cells or both, and then put in, as seen with the blue light, a single-use sterile optic fiber to booster the mitochondria and have anti-inflammatory effect, enhance NO. So there are many things behind the interstitial irradiation. This would be one of the examples. You see the narrowing of the joint space before the treatment. You see the starting of osteophytes, and after PRP, stem cells, and interstitial laser irradiation. First of all, the patient became totally pain-free. Secondary, we see the clinical improvements on the objective method by X-ray irradiation. And we are now conducting a study going into more detail in the different stages. Well, grade 1, external irradiation with good coupling is fantastic. And after a few treatments, patient will get the subjective improvements. And if we do ultrasound or other forms of imaging, we will see on the imaging as well. Grade 2 would mean more interventional. There we usually work with PRP or PRP plus exosomes. Of course, exosomes are more expensive than the PRP, so sometimes it has to go to the money that the patient can spend for the disease. Grade 3, it's almost where the orthopedic surgeon, you can't avoid, you need total replacement of the knee. There we need almost the whole equipment. There we do under sterile conditions, under imaging, injection into the knee joint or the hip joint, or omarthrosis in the shoulder joint. And after interstitial irradiation, we do external irradiation as well. So grade 1, usually as seen in these both slides with good coupling, irradiation transdermally. Grade 2, usually combination of PRP and interstitial irradiation. Grade 3, interstitial irradiation with PRP exosomes and follow up with several times of transdermal irradiation. And finally, in the grade 4, quite often you can't avoid the operation, but you can get the patient pain-free until the operation will take place. And I have some miracles where the orthopedic surgeon said, well, there's no doubt you need a hip replacement, knee replacement, and the patient started to walk 10, 12 kilometers a day. In this grade 4, it's not only the photomedicine, but it's the use of anti-inflammatory substances like MSM, a high dose of vitamin D3, magnesium, using of selenium to enhance the lymphatic flow and other substances. And in all situations from grade 1 to grade 4, the transdermal irradiation after injection is extraordinarily beneficial. Well, another example to show you the fantastic results of combination of photomedicine with exosomes is the boulding. So in early situations, just transdermal laser irradiation will stop the progression and sometimes will enhance improvement. Then you may go for PRP and photomedicine. But in severe situations, high grade of boulding in the front and in the occiput region, then you have to go for more intensive method. You have to inject high quality exosomes and do transdermal irradiation. Once again, with a good coupling as shown here in the pictures. Well, to come to the end, to the summary, photobiomedicine enhances the effectiveness of PRP, platelet-rich plasma, enhances the effectiveness of injected exosomes, and enhances the effectiveness of mesenchymal stem cells in many different ways. This is the idea of the European Laser Academy, inducing, activating self-healing, inducing the capacity, activating the healing capacity of the patient. Heal, repair, and if necessary, reconstruct. PBM plus exosomes plus mesenchymal stem cells offers us a revolutionary way to support, to empower the self-healing by activity, our body's own cellular healing capacities. Fortunately, we do have. We combine the patient's cells with a younger and healthy population of mesenchymal stem cells and natural growth factors and proteins, or we use external donator exosomes to activate, to reactivate the self-healing capacities of the patient. Natural derived growth factors of exosomes plus PBM enhance the cellular differentiation, modulate, reduce inflammation, enhances the new building of vessels, the angiogenesis, promote cellular bioactivity, promote cellular differentiation, and by all this, enhancing healing processes. Well, use the power of light in combination with other methods to booster healing methods. Thank you very much. And I'm very happy that in the second part, we get a specialist, another specialist for photomedicine to demonstrate some other fantastic devices to apply photomedicine. Give you clear information how to start in your clinic. If you want to activate the autologous mesenchymal stem cells of a patient by bringing light photons into the bone marrow, you have to use, for example, the RJ laser superpulse cluster probe with peak pulses up to 300 watt of non-visible near-infrared light, bringing photons down into the tissue and an outburst of circulating stem cells into the bloodstream, which you can harvest afterwards from the peripheral blood and re-inject into the area where the problem is, into the osteoarthritic joint, maybe omoarthrosis or onarthrosis or hip arthrosis. And then you use the same needle to put in sterile single-use optic fibers like the photon care moonlight starlight and bring the different colors that are required into the joint space. So anti-inflammatory, the blue light, anti-aging effects, the blue light, enhancing oxygen uptake, green light, regenerative effects using the yellow light, and most important, probably, boosting ATP production, which is best done by visible red or non-visible near-infrared light. But of course, the patient will need follow-up treatments. And for these, the BioFlex devices are just fantastic. You can use in the primary setting as well. But they offer terrific tools for home care methods. You can give to the patient, for example, after balding, you get fantastic contact to the skull. You get good flow of photons down into the roots of the hair. And it's even fantastic for neurodegenerative diseases, prevention of Alzheimer's or early treatment of Alzheimer's and other neurodegenerative diseases. It's fantastic. You saw in the slides before, by the flexibility you can use for tennis elbow home care methods, or the follow-up treatment of the gonarthrosis. So you have a huge variety of different tools that can pick up the individual problem of the patient and give you a holistic concept and outstanding clinical results that will distinguish you from most of the colleagues just injecting some exosomes without photomedicine. Stay with us. Be on photon care. There will be a huge number of upcoming webinars in the future. Get our channel and make yourself informed to the benefit for your patients. Your Dr. Michael Weber, European Laser Academy and European Laser Clinics.